Hi everyone, my name is Precious, and today I'll be talking about the topographical anatomy of the pharynx. So, in this PPT, I'll tell you about the boundaries of the pharynx, the subdivision of pharynx and its features, the layer by layer structure of the pharyngeal wall, the blood supply, nerve supply, lymphatic drainage, and we'll talk about some of the clinical aspects in the end. So, what is pharynx? Pharynx is a wide muscular tube situated behind the nose, the mouth, and the larynx. It extends from the base of the skull to the C6 vertebra and is situated directly in front of the six superior cervical vertebral bodies with their deep muscles and prevertebral fascia. At the flanks, there are large vascular and neural cervical trunks. If we go downwards, the pharynx is continuous with the esophagus. The upper part transmits only air, the lower part transmits only food, and the middle part transmits both air and food. So, what are the functions of the pharynx? Pharynx acts as a conduct for air between nose and larynx. It ventilates middle ear through the eustachian tube. It prevents the entry of food into nasopharynx from oropharynx. It acts as a resonating chamber for the voice and also acts as a drainage channel for mucus as well as facilitates deglutition. If we talk about a normal pharynx, the length usually varies from 12 to 14 cm, whereas the width can be maximum 3.5 cm and minimum 1.5 cm. Here you can see in the picture or in an animated picture the movement of food and air separately. So, if we talk about the boundaries of the pharynx, it is superiorly bounded by the base of the skull, specifically the body of sphenoid and basiocciput. Inferiorly, it is continuous with the esophagus at the level of C6 to cricoid cartilage. Posteriorly, it is bound by the prevertebral fascia and C1 to C6 vertebrae. Anterior boundaries are deficient as it communicates with the nasal cavity through nasopharynx, with the oral cavity through oropharynx, and with the larynx through laryngopharynx. And on the lateral sides, we can see the medial pterygoidal palate, tongue, hyoid bone, thyroid, and cricoid cartilages. And also it communicates with the middle ear through the auditory tube. The pharynx or the cavity of the pharynx is subdivided into three subdivisions: the nasal part, which is nasopharynx, the oral part, which is oropharynx, and the laryngeal part, which is laryngopharynx. Now let's talk about Pyrgos lymphoepithelial ring. Basically, before entering through the pharynx, there are six tonsils which form this ring. It is composed of paired palatine tonsil and tubal tonsil and unpaired lingual tonsil as well as pharyngeal tonsil. So let's look at nasopharynx, which is also called epipharynx. It is basically situated behind the nose and is extended from the base of the skull to lower border of the soft palate at C1. Its main function is respiratory and is lined with ciliated columnar epithelium. The mucous membrane is supplied by the pharyngeal branch of the pterygopalatine ganglion. Anteriorly, the nasopharynx communicates with the nasal cavity through the posterior nasal apertures, and the roof and the posterior wall are formed by the body of sphenoid, basiocciput, and the anterior arch of atlas. Inferiorly, it communicates with the oropharynx at pharyngeal isthmus, and also nasopharyngeal tonsil can be seen here. If we look at the clinical aspects, the enlarged pharyngeal tonsils are called adenoid, which may obstruct the airway in children. Next, we move on to the oropharynx, which is also called mesopharynx. It's the middle part of the pharynx and is situated behind the oral cavity. Basically, it extends from the left of soft palate to the epiglottis at the level of C1 to C3. If we talk about the boundaries of the oropharynx, posterior boundary is bounded by the body of axis and C3, and the anterior boundary communicates with the oral cavity through the oropharyngeal isthmus. Superiorly, it's continuous with the nasopharynx at nasopharyngeal isthmus, and inferiorly, it's continuous with the laryngopharynx. Laterally, we can see the palatine tonsil, which is situated in the lateral wall of the oropharynx in the tonsillar fossa. Coming on to laryngopharynx, which is also called hypopharynx. It extends from the upper border of the epiglottis at the level of C3 to the lower border of cricoid cartilage, and at C6 it's continuous with the esophagus. The boundaries of laryngopharynx can be as follows. The posterior boundary is bounded by the C3 to C6 vertebrae, and anterior boundaries are bounded by the downward inlet of larynx, the posterior surface of arytenoid cartilage, posterior surface of lamina of cricoid cartilage, and piriform fossa. Let's talk about a layer by layer structure of the pharyngeal wall. So the first layer is the serous layer. Then we have submucosal layer, which is further divided into outer longitudinal layer, which is formed by three elevator muscles, namely stylopharyngeus, salpingopharyngeus, and palatopharyngeus. And also we have inner circular layer, which is formed by three constrictor muscles, which are superior constrictor, middle constrictor, and inferior constrictor. And the last layer is the mucous layer. The blood supply of the pharynx is basically by the ascending pharyngeal branch of the external carotid artery, ascending palatine and tonsillar branches of the facial artery, dorsal lingual branches of the lingual artery, greater palatine, pharyngeal, and pterygoid branches of the maxillary artery. The venous drainage is by internal jugular vein and the facial vein. The lymph drainage of the pharynx works in two types of systems. If the lymph drainage is direct, it goes directly into the deep cervical lymph nodes, or if it's indirect, it goes via the retropharyngeal or paratracheal nodes into the deep cervical nodes. These nerves supply the pharynx, namely the pharyngeal branch of the vagus carrying fibers of the cranial accessory nerve, the pharyngeal branches of the glossopharyngeal nerve, the pharyngeal branches of the superior cervical sympathetic ganglion, the glossopharyngeal nerve, external and recurrent laryngeal nerve, which innervates the inferior constrictor muscle, the maxillary nerve innervating the nasopharynx, lesser palatine and glossopharyngeal nerves, which innervates the soft palate and the tonsils, and the greater petrosal nerve with the branch of the facial nerve and lesser palatine branches of the pterygopalatine ganglion. Now let's talk about the clinical anatomy or the clinical aspects. So the common pathologies which can be seen and are related to pharynx are the tonsillitis, which is inflammation of the palatine tonsil, quinsy, which is peritonsillar abscess, adenoitis, as I already talked about, is the inflammation of the nasopharyngeal tonsils, which can block the airway in the children. We also have Zenker's diverticulum. It's basically due to neuromuscular incoordination of the inferior constrictor muscle. Pharyngitis can be seen, which is basically the inflammation of the pharyngeal mucosa. And also, the nasal pharynx is a pretty common site for carcinoma in the fossa of Rosenmiller. A very important thing to note that is infection from the nasopharynx can easily spread into the middle ear through the auditory tube, as you can see in this picture right here. And the last pathology which we'll talk about is the retropharyngeal abscess. So that was it. Thank you for listening. Hope you understood.